Welcome back to another episode of Recharging the Human Battery. I'm your host, Dr. Stefano Sinicropi. We are on AM 950 radio, and I hope you guys are all having a fantastic day. So on this program, you know, we talk about so many different topics, anywhere from, you know, health to lobbying down in D.C. to you know, what's going on with your ability to access the healthcare system. And so there are just so many different topics that I think that the public is, I don't want to say, you know, confused on. I think that because of the way that our society has formed and the way that the ideas are put into our minds, what we are getting is a lot of siloed thinking from, let's say, traditional Western medicine ideas, from corporations, from insurance companies, from all these people. And the truth is, everybody has, you know, an agenda behind this. And in my upcoming book called Wellness at the Speed of Light, which is going to come out here late summer, early fall, depending on when they end up doing the launch date for it, I really talk about the way that the different forces really are shaping the landscape of healthcare in today's environment. And this really does affect you. And that's why I was so passionate about writing the book. I mean, what the book is really about is, one, I just kind of break down things about myself because you just need to get to know who I am and understand why I'm coming up with kind of the thoughts that I have, but then really talk about the dysfunction in Western, you know, healthcare and why it is leading to poorer outcomes in the general population. And we talk about all the different forces. So what do I talk about? We talk a lot about the way that hospital systems work, the way that physicians are trained and the mindset and how they're approaching these things. And then we talk about long-term care and nursing homes. And I do touch upon the what's going on in the pharmaceutical industry as well as the insurance industry, although those topics are things that people are really getting to know that. So I don't focus that much on it. Really, the remainder of the focus of the book is how to become the CEO of your own healthcare. Again, a phrase that I take from my good friend Margaret, who's up in Toronto, and one that really needs to be spread. And now I'm hearing like some of my colleagues are now using that. Somebody just used it in a talk the other night. So these are the ideas that are spreading around. But I thought that in today's show, we should spend some time talking about one of the most common problems that we see, not just in the United States, but across the world. I don't know if you guys know this. In the last 3 months, 39% of the population has experienced a low back pain issue. 39%. That's like pushing half of people at some point in the last 3 months have had a back pain problem. It's a huge problem. We're talking hundreds of millions across the globe. It's one of the most common things I see, obviously, as a spine surgeon. It's absolutely at the top of the list of things that is seen in the ER, is seen in urgent care rooms. And I'm telling you, people are directed in so many different directions when they come in with acute and or chronic low back pain. So I thought I would spend an episode talking about that because, again, there's so many of these outside forces coloring the way we think. You know, and when I talk to my patients, from one patient to the next, people will come in with these fixed ideas about what needs to be done about their low back pain just based on what they've seen in advertisements, seen on social media, heard from their primary care doctors or other specialists that they've seen. And I'm telling you, I walk into the next room, like a completely different recommendation has been made, totally 180. Some people like alternatives. Some people are going hardcore. Some people just want surgery, even if they don't need surgery. It's just one of the most fascinating parts of what I do on a daily basis. So on the other side of the break, let's break down a potential treatment algorithm for low back pain, and we'll just talk about some of the different therapies out there, including alternative therapies. This is AM 950, Recharging the Human Battery. We'll see you on the other side. Okay, everyone, welcome back. We're on Recharging the Human Battery Radio. I'm your host, Dr. Stefano Sinicropi, going at it solo today. And we're on AM 950 radio, excited to talk about something that, I get to talk about every day, all day. I just had a huge clinic yesterday. I would say maybe half of the patients were in for lower back pain, and the other half were in for, neck pain and other related situations. But low back pain is a huge problem. Like I said on the, before the break, it affects so many people, and it can honestly become a really devastating problem to some. And I have seen, and you guys have heard me talk about this before, the reason I'm so passionate about taking care of people with musculoskeletal disorders, and honestly everything at this point, doing so much integrative health now, is because I have seen people that are so vibrant. They're in just such a great position in life, and then they get an injury. Now, the injury could be simply they wake up with it, they twisted wrong in bed, they bent over, or it could be major, traumas, which obviously we take care of quite a bit. But the bottom line is, I have seen so many people go from highly functional, having really great lives, okay, to being completely a shadow of their former selves, addicted to opioid medications, having had multiple procedures, injects, all kinds of things. And some of them I've known because, I've been practicing for about 20 years. Some of them, I could give examples, but just one off the top of my head, I had this one lady that I knew, and it started, pretty simply. She hurt her back. She's a nurse. She was lifting a patient, and we're talking 15, 16 years ago. And so she came in. We started treating her. It was all conservative treatment options. Then she disappears for about a year and ends up getting a whole host of injections and all kinds of things. The problem is that at that point, she had been put on a lot of medications, including high-dose narcotics. Now, for acute pain, like if you break your leg or you have a massive disc herniation and you just can't breathe, which happens. I've seen people devastated. Yes, a short-term burst of opioids is fine. But in general, for people that are having more controllable pain, opioids is really not the answer, and it's something we could do an entire show on the opioid crisis. And I've gotten some pushback when I push back against opioids. There are so many people that are unfortunately addicted to these things, and now they need it to sustain their lives, because when they come off of it, there's a lot of withdrawals, and it's an entire show that we could talk about how it works and why it's such a huge problem, especially in the United States. We are really the leaders in opioid crisis issues for pain. And I'm really passionate about it. And again, I'm not against it, but let's go back to this nurse. She comes back to me. She's on high-dose opioids. She has had all these procedures, nothing surgical yet. And so now she's not working anymore. And so there's a big problem because it's difficult now to treat her pain. So we watched her for a while. We tried to really wean her down on her opioids. Eventually, we did a very small surgery on her, just a minor decompression surgery. We're talking like a 40-minute operation just to take care of that, because she had many, many other problems in her spine. But given the point where she was, I did not feel that doing a major surgery on her would be beneficial. There's just too many pain issues at that point. Problem is, she got some improvement in her leg pain because she had a lot of what we call radiculopathy pain down the leg. So that got better, but she had chronic back pain. Now, I'll tell you, in that time, the focus for her was, again, more medications, more other treatments, right? Not focusing on core muscle stabilization and strengthening, meditation, breath work, all these things that we talk about endlessly. Again, she disappears again. I am telling you, the next time I saw this lady, I just remember her because I knew her from before. I knew her from my work life. So I know this person. The next time I saw her was a couple years later. This person, and just think, this all started with just a simple act of lifting a patient. Now I see her a couple years later. She looks like she's aged about 15 years. Lifestyle is completely terrible. Everything's bad. Diet, everything. No exercise, not following any physical therapy, not doing anything. At this point, on massive doses of medication, actually has a pain pump placed. By this point, I will tell you, I don't even know who I was looking at that point. I'm telling you, that is why and the people that, are kind of around me in all these different ventures that we're doing right now, the level of commitment to preventing that from ever happening, it couldn't be stronger. I mean, honestly, we have to prevent that. So for many reasons that we talk about before we talk into kind of what is the algorithm, like what do we do? Like how do people avoid being that nurse, right? We really need to think about the downstream ramifications of this nurse. Why? It's not just about her and her family, the fact that she can't work, and I doubt that she'll ever work again in the position, that she's in. There's no way. I wish I could show you before and after photos. I think we might get, some people might cry if you saw the difference in what she looked like. Let's talk about now. This is one. I'm talking about one human being. Let's take that and make it millions of people's lives. And it's not just back is a big component. What about people that have severe migraines that are not treated well? What about people that have neck injuries and whiplash? We did an entire show on that. You've got millions of these people out here. Okay, so why should you care? Number one, you should care because if you or your family are experiencing these things, you definitely should care because you want to get the right type of treatments. But the reason we should care is because what happens societally? You have a bunch of people that can't work anymore. You have a bunch of people that are very unhappy, they're depressed, they're miserable, and so they're consuming even more medical resources. They're ending up in emergency rooms and filling those. They are really in the throes of the opioid crisis in many cases. But from a larger view, from like what the government should be looking at, what Congress should be looking at. And again, I was just there last week, and you talk about, I'm just going to say it. I mean, it's a clown show down there because they can't get anything done. But anyway, what people should be thinking about is we've got millions of these people, and they're just around. And guess what? I see them, and I'm telling you, they're devastated at this point. The pain clinics in our country they're bursting at the seams. I don't want the people to be there. I don't have anything personally against pain clinics, but this is not what we need to be doing. And so from an economic burden, remember I quoted this a million times on the show, $4.4 trillion we spend on mostly sick care. 90% of it is sick care. A lot of it is on chronic disease. But when we say chronic disease, a lot of it is chronic pain. And when we break down chronic pain, boy, it points right to that low back. Low back pain, it just devastates so many people in our society. It costs us billions, and billions of dollars to take care of these people on so many different levels, not to mention that they then have to get government assistance because they can't work. So not only are they consuming massive medical resources, are contributing to a pain medication crisis that we have, but it is just absolutely overwhelming us with people that can't work. They can't be, and again, there in no way is it most of them. It's not really a fault of their own. It happens. Life just happens, and it snowballs. And when I talk to these people, so many of them say to me, I can't believe this happened to me. They don't even know who they are anymore. They can't even remember their former selves. And so it's really important to, as much as we can, as a medical community and society, whether you're a physician, a nurse, a chiropractor, anybody, or you're just a concerned citizen, or you're an advocate for your family, we all have to work together to prevent people from going down these paths. And there really are, I really think there are ways. Now, have we solved everything? No. Can we prevent everybody from going down that path? No. Sometimes the injuries are so severe that they're going to end up having nerve damage and things like that. I'm not really focusing on that crowd. I'm talking about bread and butter, low back pain issues that happen every single day that can be managed in very specific protocol-like ways. It's not a one-size-fits-all. I don't want you to think that, but it's certainly there are a lot of treatment options. So I'm just going to give you my thoughts. Again, none of this is medical advice, but let's think about how to handle different situations. And so when we talk about low back pain, and I'm going to try to piece this all together, and it's complicated. Honestly, I probably need 5 hours if we were really going to dive into every different condition that you can get in your back. But let's just divide it into two types of low back pain. Let's divide it into low back pain where it's just the low back that hurts, and then let's divide it into patients that have severe, what we call sciatica or radicular pain. It's really, they are really kind of different animals, insect, and a lot of times there's a blend, but let's just take them. So let's just talk about chronic low back pain, and I'm going to just tell you what the steps are and the way that I've changed my own personal treatment algorithm. Again, it's my algorithm. This is my opinion. Yes, I'm a physician, but if you want to learn more about this, please come and see me either at Midwest Spine and Brain, or you can see me at Hypercharge Health for a more integrative kind of holistic approach. But regardless, again, not medical advice. So you've got low back pain. So the typical patient will come in. Let me just throw out a patient, 50-year-old lady who, again, we'll just do it like the nurse. She was lifting. She picks up her mom, tries to help her, out of a wheelchair, let's say, into her bed, and feels a pop in her low back, throws herself on the floor, is just writhing in pain, goes to the emergency room, gets a shot of Toradol, gets sent out. You need to follow up with a doctor. Okay, I see this patient. They have an MRI scan. Typically on the MRI scan, just to let you know, the findings of disc herniations in people off the street are generally going to be whatever your age group is. So if you're in your 30s, you have a 30-something% chance of having a disc herniation, even with no pain. If you're 60, it's about 60%, and so on from there. These are just rough guidelines. It depends, which articles you look at, whatever population studies have been done. But it's in that general category. Basically, the older you get, the more likely you are to find things. So we don't treat the images for low back pain. We treat the symptoms, unless something is, obviously, if they have a tumor or something like that. I'm just talking about, this is garden variety stuff. So this patient comes to me. They've got acute low back pain. They have a disc bulge, no nerve compression, but they are miserable. I can see it in their face. I'm talking to them. I do some tests on them. They're wincing. They're clearly, the spouse is with them. They're looking at me like, oh my God, doc, you got to do something. They're saying, often those patients will be like, oh, I got to get on, I need some kind of a narcotic or something like that. I can't take the pain. So first of all, obviously we do a thorough exam and a history. Is this the first time? Has this happened before? How did you treat it before? What was successful? What was not successful? So generally for this category of patient, kind of the disc bulge or the more milder changes, people can have devastating pain with that. But we know there's not a lot of nerve impingement. It's not in that category. So I will tell you, on those patients, those types of big gun medications is a no-no. We don't want to expose what we call narcotic naive patients to these types of medications. And I will say that here in the state of Minnesota, emergency rooms, I am very proud of the work that the medical community has done, because for the most part, those patients are not getting narcotics anymore. That was a thing, but it is going away. But unfortunately, in some circles, they still are getting that. That's the kind of a no-no in that circle. Yeah, I mean, if you want to do it for a night because the person literally is going to be hospitalized, that's a little different. But again, we're not talking about that. We're talking about moderate pain where most of you are listening to this. You've been there. You've had that episode of low back pain where you're like, I don't even know what am I going to even do? It happens to me many times. I've had it at least 5 or 6 times in my life. And it's a problem. So how do we treat this patient? So always the staple of this is getting them recovery. So I think more of an active recovery, program is better than just telling people to rest. It has to be very gently done. So typically we will get them into a setting of physical therapy or chiropractic care and give specific instructions to do very slowly progress them, because obviously we don't want to aggravate them, and that can be a problem, especially if the therapist really tries to push them. That's not the time to push them, but they're pros, and that's what they do. Then I have to make the decision, is this a patient that we want to put on some kind of medication? So go-to is really the nonsteroidal anti-inflammatory medications. You know them, ibuprofen, Celebrex, those kinds of things. Again, not medical advice, but anti-inflammatories are great in this setting. Maybe potentially even sending them somewhere to get a shot of Toradol, but really high dose anti-inflammatory medications. This can really bring down those pain levels. I will tell you that timing is important. Before we even get into this further, the faster we can get control of your low back pain, the less likely it is that you're going to float into that chronic low back pain, which is back pain longer than 3 months. Once you get into that chronic low back pain, stuff gets tougher. It gets a lot tougher there. So let's treat you early. So nonsteroidal anti-inflammatories. Sometimes we look at the disc and we can add things like a cortisone shot if indicated. If somebody has a normal disc and I can't clearly see a tear in the disc or a disc bulge that's at least close to a nerve or touching a nerve, or they don't have those types of symptoms, I don't do that. It's not really indicated, but in some cases it really is indicated. We obviously look at the other structures and see if there's anything we can do in an acute phase. One of my favorite tools now, and it has made such a dramatic impact in my practice, especially in people that clearly don't need surgery but are hurting, is the addition of tools like laser therapy. We've talked about class 4 laser therapy. It's in high intensity beam of infrared light. It can penetrate very deeply and improves blood flow. It restores mitochondrial function, the powerhouses of the cell. But the big thing, it really tamps down on the irritation of the small nerve roots that are associated in those areas and can really dramatically reduce pain. Remember, the quicker we reduce pain, the less likely it is that you need to go to big gun type of treatments. Once we get them kind of through that, one of the things that is completely changed in the way that I manage these patients is what I have found is with physical therapy, many people can't even do therapy because they're in too much pain. So again, like I said, we give parameters to the therapists, and it has to be gentle. And again, they're pros. They know what they're great. We have amazing physical therapists here in Minnesota, amazing chiropractors as well. The ones I have very specific chiropractors I refer to, fantastic. But a lot of people are limited by pain. This is a problem I've had. So I just gave a lecture on this exact topic. One of the things that we've added to the treatments, and people that are willing to do it, is we're now using a device called the M-Sculpt Neo. What is the M-Sculpt Neo? The M-Sculpt Neo are basically pads that you can put on the body that can give high-intensity stimulation to the muscles. So you can basically replicate a complete workout of your core muscles without moving. Why is this beneficial? Because obviously movement can aggravate their low back, but we want them to strengthen their core muscles because that is going to help them to recover. So using devices like the M-Sculpt Neo, which we use at our integrative clinic, Hypercharge Health, is a dramatic way to strengthen the core muscles, and it is FDA cleared for that particular indication. So it's very exciting. It actually has 6 FDA clearances. And so now you can see what's the strategy. non-steroidal anti-inflammatory medications, potentially injections, physical therapy, chiro, and then really building back that core without movement. This formula is fantastic for getting people better. In some rare instances, I will prescribe more systemic steroids because the patient will come in and they'll say, hey, I'm a trial lawyer. I'm actually presenting a case to the Supreme Court in 2 days. I literally cannot stand up. So in those cases, understanding that there are always risks of even systemic steroids, even doing it one time, we may, do that. But I'm very, candid about, as we should be, obviously, about the potential risks of any medications that we give. So that's one variety, again, of the low back pain. Let's talk about another variety. Again, this is low back pain alone. Again, the vast majority of those patients will never have to go down the route of having a surgical intervention. Another low back pain, very typical that comes in, people that have something called spinal stenosis. Spinal stenosis is narrowing of the spinal canal and pinching of nerves. It typically happens over the course of time, and there's two different variants. There's a variant where they just have back pain. They may have a slip of one bone on the other. That's called the spondylolisthesis, or they may just have spinal stenosis and have a lot of back pain. Those patients we treat very differently. Yes, all of the things I mentioned before absolutely are indicated for those. The difference is in these patients, because the nerve roots are compressed without necessarily leg pain, doesn't matter because they are going to report a lot of symptoms with standing and walking, which gets better with sitting. Regardless, all the laser therapy, all those things help improving core musculature, great, especially with something like the mSculpt Neo. But also, we do a lot of injection treatments with them. We know by the studies in the literature that patients that have especially moderate or less amounts of stenosis absolutely do really well with cortisone shots in addition to these other conservative measures. And it can make a huge difference. People come in, sometimes they get actually sent for surgery because they're like, oh, you've got like a medium level of stenosis. They're sent, their family doctor will send them for surgery. And I tell them, I've followed patients for 10 years with spinal stenosis. We've not done surgery on them. Every once in a while, they'll get a cortisone shot. Now, they get the additional laser therapy and the core muscle stabilization and strengthening. So you're not necessarily going down the path of something surgical. Now, if you have severe spinal stenosis, especially with a slip, in those cases, I at least put surgery on the radar because, number one, the results of surgery are excellent, but number two, we know those patients are less likely to do well with conservative management. Even all my favorite, things like laser therapy, I tell the patients, yes, you might get some temporary benefit, but you have such severe compression on the nerves that you might be going down the surgical path. So we rely more on our interventional specialist colleagues that could put some steroids around there and help those patients. And then the third bucket of people that I see with low back pain are people that have deformities. So deformities, and we don't have time to get into this. This is an entire show. You guys know it as scoliosis. There's another thing called kyphosis where the spine is tilting forward. There's one bone slipped on the other. Those are called spondylolisthesis. All these different terms you might hear. That bucket, and this is in the low back pain category. I'm going to add one more just for good measure. But anyway, that is very specific. So depending on the size of the curve and what we see, we recommend different things. This is why it's outside of scope. Bottom line is, even those patients, we want to stay away from narcotic management or other things. And we really have to have a good sense for how do we get this patient better so that they don't become a chronic back pain patient and, even worse, at some point become disabled. And we talked about all the downsides of all these people that have disabilities and really a downside for them, obviously. The last category before we get into the radiculopathy, which is different, is the patients that have sacroiliac joint problems. A sacroiliac joint is the joint between the pelvis and the low back. It is very common. It could potentially represent 40 to 50% of people that come in with an acute symptom of low back pain. A typical injury where we see, kind of that is, kind of a mild to, like a medium, I would say like a low to medium size, like car crash, Shoveling, huge. I see so many sacroiliac joint injuries from shoveling that are misdiagnosed as disc problems. The reason I bring up the sacroiliac joint, and again, this is really important. That's why it's so important for you guys to seek care from people that really understand how to manage your pain initially, not just with drugs, because we got to get to the root of this. Why do I mention SI joint or sacroiliac joint? Because if you end up going down the path of having all of these treatments to, like, for example, a disc in your low back, but it's the sacroiliac joint, that is a recipe for getting into a disabled state. I'll give you one example. I had a patient who I saw him. It was the first time I saw him. I diagnosed his SI joint problem in about 5 minutes. This is the most obvious, just from the history and what a problem is. He'd had this problem for about 5 years. So he got into the category of what's called a sacroiliac joint dysfunction. It could be very devastating. I've seen there's people that are admitted to the hospital. All kinds of stuff can happen from your SI joint. Bottom line is, guess what this guy did? He was miserable. He had degenerative disc disease in his low back. Unfortunately, none of that had anything to do with anything, because it was just garden variety degenerative disc disease. I have it in my back. Most of my colleagues have it in their back. Guess what? I don't have any pain right now. I'm doing fine. He went to France and got a 4-level total disc replacement and paid an obscene amount of money, because this was the time where we weren't doing as many disc replacements here in the United States. 4 levels, unfortunately, are still not approved. That's a whole other discussion. But anyway, he ended up having major surgeries. He actually had a complication from that surgery in France, ended up staying in the hospital for a while. It turned into a vacation he wished he had never done before. But here's the deal. He comes back to me, zero pain, nothing from all that surgery, and it ended up being his SI joints. Guess what? We treated his SI joints. He was fine. And he's lucky, because usually when you have 5 years of chronic pain, it's hard to treat that. But we did high level, and we ended up doing something called a radiofrequency, where, burn the nerve endings in the SI joints and done stuff. Now, today, I probably would have referred him for stem cell therapies, because those are so effective. But regardless, he had a good result. He did well. Very thankful patient. But look at the ordeal he underwent. Luckily, this guy was a very high functioning guy. He's big time executive, and he knew he didn't want to get addicted to narcotics. He didn't want to do those other things, so he was able to skirt the system, but he suffered for many, many years because of a misdiagnosis, a big misdiagnosis. So it's very important to get the right thing. So right diagnosis equals right treatment. Okay, that's that bucket. Let's get into the radiculopathy, which we make very simple. That is when something is pushing on your nerve, and then you're getting sciatica. So the more common term is sciatica or radiculopathy, where the pain is going to travel and go all the way down the leg. In those cases where then it correlates with the MRI finding with severe nerve compression, then those people, we are much more likely to treat those patients again right away with injection therapies, laser therapies, anything to decrease the swelling around that nerve. But in those cases, I'm just going to be perfectly frank, as opposed to a lot of the other patients that I talked about before, where I tell them surgery is way down the road, with people that have pretty severe sciatica radiculopathy, we want to really try to manage that acute pain in a very short period of time, because you don't want that nerve to be what we call, like, it's a hot nerve or an inflamed nerve for long periods, because then you could get that kind of circuit going in your brain, and it's harder to reverse. So I try to really get that rooted out right away. So I'm really hopeful that these patients come and see us as soon as possible, because we want to get them in the system and being treated. So they're steroid injections to that area, combined with laser therapy, combined with strengthening. Again, their core muscles are very effective early on. But again, they're more in the category of the severe spinal stenosis, where I do preempt them with surgery. Why do I talk to them about surgery earlier on? Because if we do the acceptable, normal, standard course of treatment, and again, I add all these other integrative, health modalities. We didn't even talk about putting them on peptides and IV vitamin drips and all. We do all that for the people that want to go there, because it's great for anti-inflammatory purposes. But the reason that I talk about surgery earlier is because what I don't want is people that have a disc herniation and have leg pain to be kind of festering around and then seeing me a year and a half and they have severe leg pain and they're miserable and they're on medications. Because, again, for an isolated disc herniation with severe sciatica where we can't get you better with multiple steroids and with all these other treatments, and even sometimes people really want to avoid it. So stem cell treatments are acceptable in that case, depending if they have clearly if they have weakness, then it's surgery right away. We're not really talking about that population. That's different. That's more of an urgent situation. But in these patients, we want to calm this stuff down right away. What we don't want is a scenario where somebody has bad sciatica and 5 months passes and they are needing a narcotic just to manage their pain. They're out of work, and guess what? They've never seen a specialist yet. They haven't had an epidural injection. They haven't been put on any kind of steroids. They haven't had laser therapy. They haven't had any of these things. And it's just different. It's harder to treat those patients. There's no question it's harder to treat those. And we've put them in a position where it's more likely they need surgery than if we really approached it early on. And I can tell you this from experience. I've seen tens of thousands of patients, done 10,000 surgeries. Again, the goal is always to avoid surgery. But boy, we got to get a handle on this early on. If you take anything, if you are in pain, please seek care from people that know exactly how to treat this and have a very well, defined algorithm. All right. Unfortunately, just going through those buckets, that just takes up a lot of time. So again, back pain without sciatica, we treat very different than severe sciatica, okay? And the severe sciatica, there's more of an urgency to it. We really got to get in control. One last comment on the sacroiliac joint for those, for those of you that are, really into this or you've been diagnosed with a sacroiliac joint problem. Sacroiliac joint problem, and I'm telling you, there are providers that don't understand this concept. You can have what appears to be a vicious sciatica, but it's actually your sacroiliac joint. I cannot stress how important it is to see where the thing is coming from and do the appropriate diagnostic testing to confirm where that's coming from. Because again, if you have, let's say, like a medium-sized disc bulge and it's close to touching a nerve, but it ends up being your sacroiliac joint, treating that disc, whether it be with whatever conservative modalities or with surgery, is bad. It's bad in a way that you're missing the actual problem. So you want to make sure that we always get the right diagnosis. And again, this can be done. There's again beyond the scope of this talk, but always ask your doctors, especially if you're seeing them, could this be an SI joint problem? Very important. Now, SI joint sometimes radiates to the groin. It can go to the front of the leg. It can go to the back of the leg. It can even cause sometimes numbness in the leg because the L5 nerve runs right in front of the SI joint. So you can get all these weird symptoms. Again, you got to go to people that really understand what's going on. So in the conservative buckets, what are my go-tos? Physical therapy, chiropractic care. Acupuncture has become a go-to. It's great for chronic pain patients. There's a lot of literature on that. People are out here trying to, sometimes debunk chiropractic care, saying, the sham studies. The sham studies means studies where they kind of fake that they're doing and the people still get better. Bottom line is there is good evidence in chronic pain that acupuncture works. It's something we offer at our integrative health clinics. We've got we have an amazing provider, Nikki. She's actually the acupuncturist for the Minnesota Twins. Fantastic. I'm a big believer. I had it done all on camera. That show is going to come out soon. Other things, we talked about the class 4 laser therapy and others. Interventional treatments, epidural injections around other structures, including the facet joints, injections inside the discs themselves, and other treatments. And then the last bucket is surgery. Again, I need hours to discuss what surgeries are available, but the gist of this is we've got to get the right diagnosis, we have to get the right treatment, and we've got to try to prevent you even getting into chronic pain. But if you're in chronic pain, there are treatments for that. One of my absolute favorites, and I'm going to do an entire show on this with one of my partners, is utilizing stem cell treatments to try to avoid surgical management. Now, you can take stem cells from the bone marrow, or you can take stem cells from the fatty tissue. You spin down those stem cells, and then you can put them around the nerves, you can put them in the disc, you can put them in all the structures in the spine, including the facet joints. What those can do is they can stimulate regeneration in that area. They change the way your immune system works, they decrease inflammation. And now we are using a lot of stem cell treatments to help people to avoid surgery. I am so excited about stem cell management and utilizing that as a way to, again, prevent surgery, especially in patients where the surgery is not as much of a home run. And again, these are tools that we need to have in our toolbox to help you to get back to a well state. So on the other side of the break, we'll close this down. This is a topic I really need more time on. This is AM 950. We'll see you on the other side. All right, welcome back. This is the last segment of Recharging the Human Battery Radio for today. This is Dr. Stefano Sinicropi. This has been wonderful being with you today. We're on AM 950 radio, and we have been talking about something that, like I said, it's so important to get a handle on how we treat low back pain condition. So we took it from, talking about like if you just have low back pain to if you have sciatica pain to the SI joint and to potential treatment. So the last thing I was talking about on the other side of the break, and I'll just finish this up, is stem cell therapies, because I just want to tell you kind of how that came about. I'm a spine surgeon. For years, patients had been coming in to me asking about potential stem cells, but it was mostly because they were seeing advertisements from overseas. And so many of my patients had traveled all over the world to go get their stem cells. And I have to be honest with you, in the first 15 years of my career, I just wasn't really dialed into the utilization of stem cells or what the studies were in spine, because it's not something that we're traditionally taught. It's not something that is, done a lot in the community. So it wasn't something that was presented to me. I didn't have any providers in town come to me and say, "Hey, we're doing stem cells. Do you want to refer us some clients?" That just never happened. So it wasn't on my radar. Once I really learned about the power of stem cells and how it can help you to regenerate your own tissues, it can help with healing, it can help with especially pain, because that's what most people are coming in for. It didn't take too long for me to really go down that path. And Dr. Louis Sager, who is now my partner at Hypercharge Health at the Institute for Regenerative Medicine, is a world-renowned stem cell expert. He's triple board certified and doing, you could put stem cells in any nook and cranny, we'll call it, in the spine, which makes a huge difference. So the literature is really showing good results for stem cell therapies in the disc, stem cell therapies around the nerves, stem cell therapies in the facet joints. And that is exciting to me, because now I can give patients even another option on top of it. So my toolbox and those around the toolbox has grown so large. And you know what that's translating to? Happier patients, a lot more treatment options. And hopefully, to be honest with you, I'm a surgeon. I'm going to say this on the mic, a lot less surgeries being done, because again, surgeries are fantastic for some cases, but the judicious use of surgeries really needs to be our main focus. And so having all these other treatments is it cutting into the amount of people that I'm going to be doing surgery? Absolutely, because we can get them better by other means. But it is definitely better for patients. And I think patients are very happy to hear about all of these treatment options for low back pain. So I really, would make a call for those of you that are listening that are in the medical community, for the lay people. Let's have a very open mind about all the different treatments. Let's all agree that the quicker we treat low back pain, the better chance we have of getting people out of situations where they become disabled and their lives are turned upside down. And let's all agree that we need to really offer patients things that are in the traditional medical system and outside of the traditional medical system, but rapidly becoming more mainstream, because things like laser therapy, stem cells, all these other things are rapidly going to become mainstream. I'm telling you, they are, because they're so powerful and can make so much of an impact in your ability to have a better function and ultimately to avoid being disabled and avoid surgery altogether, potentially, not in all cases. And so happy to talk about it more. Leave your comments, down below if you're watching this on YouTube. Also, happy to see you at Midwest Spine and Brain. Happy to see you at Hypercharge Health, where we have more of the integrative health measures. But overall, think about this. Please get us your questions. Love to answer them. This has been a great episode. This is Recharging the Human Battery. I'm Dr. Stefano Sinicropi, AM 950 Radio. We look forward to seeing you on the next episode.